Sex is like something like we call it a new shirt phenomenon. Suppose you buy a new dress or new shirt. Few days it is very exciting to wear the shirt, but as days goes by, you feel that it's the same old thing. I am Dr. Deepak Bolbandi, Senior Consultant Urologist at Apollo Hospital, Bangalore Road, Bangalore. Today I am going to share my experience since last 20 years about reduced libido or reduced sexual life in young generation. If at all you look at the history, sex is one of the important aspects of everybody's life. People who have some amount of sexual discomfort have a lot of familial fights leading to divorce and all those things. Of late, we have seen increase in number of divorce rate, especially in young professionals. The main reason for this is reduced sexual drive. As we have seen since last 2019 onwards, because of the pandemic, the work from home has increased to tremendous extent. Both the working professional, especially the software engineers, the IT professionals, both husband and wife are working from home. So unfortunately, it is a double-edged sword. They are spending more time with each other in the house. They are knowing their deficiencies. In that one deficiency, what we have seen is reduced sexual drive. Post-marriage, if you look at sex is like something like we call it a new shirt phenomenon. Suppose you buy a new dress or new shirt. Few days, it is very exciting to wear the shirt, but as days goes by, you feel that it's the same old thing. So you would like to look into that aspect. Reduced sexual drive is very common in patients who smoke a lot and who have alcohol more than what is recommended. In fact, both alcohol and sex reduce the sexual drive. The other important aspect is diabetes. What we have seen during our last 2 to 3 years, there is tremendous increase in young diabetics. Before and all, we used to see diabetes setting up around 40, 45, 50. Now we see 20 years old, 25 years old coming up with diabetes. Once again, the most important factor is work stress and abnormal lifestyle. What IT professionals they do is they work for US standards, but our body is used to work for Indian standard. Suppose from the childhood we sleep at some time and we do our work at certain time. But if you look at the IT professional, the cycle will exactly get reversed. When we are sleeping, they are awake. When they are awake, we are sleeping. In that aspect, what happens? The whole body mechanism is altered. The hormone changes will happen. So what we see is, if I give an example, the husband will be working in a night shift, the wife will be working in the day shift. So they try to combine each other some weekends, Saturday and Sunday, where we usually see them meeting up. So during that, what happens? Either husband is not interested or wife is not interested. In this aspect, there will be some amount of emotional conflict in this group of patients. So automatically, once the wife is interested, the husband is not interested, the husband will lose interest. In this, there are two components. One is lack of interest, other is lack of performance. Lack of interest, once again, is basically because of misunderstanding between husband and wife. Sex is only 10% physical, 90% emotional. If their emotional quotient is good, automatically the sexual drive is much better. The sexual drive is very less in this group of patients because of one is work stress, second one is abnormal lifestyle, and other important thing is expectation. What of late we see is they see lot of internet, they see lot of movies, they try to replicate what is there in the movies or in the net without realizing that what is their capacity. Once they try to replicate, they fall short of their expectation. Either the wife will short of husband expectation or husband will fall short of wife expectation. So in this scenario, once again, more than medicine, the counseling is most important. What we do is, first we evaluate this patient, we counsel them. We asked, in general, how about your lifestyle? Husband tells that, sir, my job starts from 3 o'clock, I work till night 2 o'clock, I eat whatever time I feel, I don't get sleep. So their whole energy is diverted to getting sleep. Sex apart, they want relaxation. The problem is they work at odd hours and the work hours is extended. Some people work up to 12 hours, 14 hours, and they keep on continuing the same work without giving much importance to their family. So we evaluate them, we try to get them back on track. First important thing is diet. These people have a lot of junk food, lot of food with fatty acids, lot of pizzas, burgers, which have a lot of fat content. So that is one of the important things which cause these type of symptoms. Next thing is lack of physical activity. Because they work in odd hours, they don't get enough sleep. So when they are supposed to do physical activity, they'll be sleeping. The third important thing is communication. We would like to communicate to the patient that your relationship with the wife has to be more of psychological. Once the psychological parameters are set in, automatically the physical factors will fall in place. We evaluate with some basic blood tests and certain scans just to find if they really have any problem. If they have any problem in these tests, we rectify it with some basic medication medication and will reassess them after 4 weeks. When the reassessment is done, usually they don't respond because they have taken medicine but they have not changed in lifestyle. Until they change in lifestyle, medicines will not work. They are best of the best medicines. Unless the patient changes his lifestyle, it doesn't work. For example, you can take a horse to the well, but you can't force the horse to drink the water. In the same way, we can suggest certain changes to them, but it is end of the day, it is the person who come to us, the patient's prerogative is to get into a better lifestyle and take the medication properly. And once they are quite comfortable, then we'll take them off the medication and they'll put them back to the track. These are the commonest group of patients we see from 20 to 30 who have less sexual drive. Next group of patients is old age patients. Once again, 50 and above. Here the main culprit is diabetes. Once we rectify the diabetes, give them the medication, automatically they will be fine. This is as far as men is concerned. Women, once again, their sexual drive will be less during the post-menopausal age group, wherein because of hormonal changes, the vagina will get dry and they'll have very painful intercourse. That's the reason they lose the interest. We give them simple ointments and with that they'll be fine. And most important thing, once again I'd like to summarize, this has become a major problem, lack of sexual drive, leading rise to a lot of familial conflicts, divorces and all those things. Most basic thing, food and shelter, if both have been protected, automatically these symptoms will not come into any individual life.